I call the member for Dixon.
Thank you, Deputy Speaker. I may as well say a couple of lines again because I just love them so much. Medicare is Labor's heart, but it is also mine. And I have had probably thousands of pathology tests over the past 10 years. My family in general has had thousands of bulk-billed pathology tests over the last 10 years, and that's one of the reasons that this bill is so incredibly important. We need to continue the bulk billing of pathology services. So I'll just go back to, Labor will always protect and strengthen Medicare. We're committed to more and better health services no matter where you live. This is in stark comparison to those opposite. Let's not forget, in their first term of office, the coalition government cut bulk billing payments for pathology and diagnostic imaging to make patients pay more. Labor is investing in pathology and diagnostic imaging. In my electorate of Dixon, more people in Strathpine now have access to more MRI scans funded through Medicare. The people of Dixon should only need their Medicare card, and that's what we're working towards, not their credit card, to receive the health care they need, which is exactly what our government is working to deliver. This licence is saving locals who get their scans done in Strathpine, and it will give patients in Dixon more choice on where to get their scan. Making MRIs more affordable is another way the Albanese government is strengthening Medicare. This bill relates to the fees imposed on the pathology sector for certain categories of pathology applications. It specifies the fees which must be paid for the acceptance and approval of approved pathology practitioner, approved pathology authority and accredited pathology laboratory applications. The approval of these applications allows the providers of pathology services to claim Medicare benefits for delivering those services. The 2022 Health Portfolio Charging Review identified that the fees set against each of these application categories had not been reviewed or changed since the Pathology Fees Act came into force a very long time ago. This bill repeals the Pathology Fees Act, will resolve this misalignment and provide fee relief, in addition to reducing the administrative burden for the pathology sector. The consequential amendments included in this bill remove all references to the payment of fees for these application categories from 1 July 2025. Accreditation obligations associated with these applications will remain unchanged, thus maintaining the quality and safety of pathology services provided under Medicare. As I've said, the Albanese Labor government is laser-focused on strengthening Medicare, delivering more bulk billing for all Australians. We are making the single largest investment in Medicare ever. This will deliver an additional 18 million bulk-billed GP visits every year, so Australians can see a bulk billing GP. We're opening more Medicare urgent care clinics. We're expanding and growing our network of Medicare urgent care clinics, opening an additional 50 clinics. 4 in 5 Australians will live within a 20-minute drive from a Medicare urgent care clinic under Labor. And I should mention our amazing Marumba Downs urgent care clinic. I've visited the facility many times. So many locals have gone there with their kids, with family members, and it's avoided a trip to the emergency department. They just love it. We're making medicines cheaper, even cheaper. Labor is providing cost of living relief to millions of Australians by making medicines cheaper. From 1st of January 2026, the maximum cost of a prescription for the PBS medicine will be cut from $31.60 to $25. Now, this makes a huge difference, particularly for people with chronic illnesses. Cutting that fee will make a huge difference over the year of how much they spend on their medicines and other things. Hiring more doctors and nurses. Labor is growing the health workforce to deliver more doctors and nurses than ever before, including the largest GP training program in Australian history and hundreds of scholarships for nurses and midwives to extend their skills and qualifications. We're investing more than $790 million in women's health, something I'm incredibly proud of. And I tell you what, every door I knocked on that was answered by a mum or a young woman, I talked about our women's healthcare package. And I tell you what, people overwhelmingly said, thank you so much. Reducing the cost of women's health is incredibly important to me and to my electorate. Labor will provide Australian women with more choice and better treatment at a lower cost, making contraceptives cheaper and funding more treatments for menopause. We're helping Australian women suffering from endometriosis and complex gynecological conditions have access to longer specialist consultations covered under Medicare. We're supporting women's health by opening endometriosis and pelvic pain clinics. Labor will open an additional 11 clinics, a total of 33 clinics across every state and territory. It will mean that Australian women can access the care they need closer to home. All 33 clinics will be supported to extend their focus to also provide specialist support for menopause and perimenopause. Investing in free mental health support for Australians, for Australian parents. New and expectant Australian parents will get free, personalised mental health support thanks to a $16.7 million investment by the Albanese Labor government to open another 8 perinatal mental health centres around the country. And I should just quickly talk about our Medicare mental health centres that we're setting up across the country. I mean, this is going to be a game changer for people who need immediate mental health support and can walk straight into a clinic and get the help that they need. I'm really pleased that we're going to have 2 in my electorate of Dickson, and I'm really looking forward to those opening up and being able to support our community with mental health services. Overall, Labor is delivering more bulk billing services across the board for all Australians. I'm so pleased to support this bill, which will mean that pathology services continue to be bulk billed for most Australians. Thank you.